Hello everybody. I'm Dr. Gloria Quadros, Assistant Professor and Blood Bank Officer, Yenepoya Medical College. So today I'm going to talk to you about awareness on blood donation. Now blood donation, as we all know, is a noble act which contributes to saving lives. Let us remember that every drop of blood is a gift of life. The need for blood is universal, but the supply is not. So therefore we need to bridge this gap. Together, by taking the simple steps of donating blood, we can make a significant difference. Now, we all know that blood cannot be manufactured, and this can only come from generous donors. So, each blood donation can save up to 3 lives. So, a donor can donate up to 450 ml of whole blood at once, which will be separated into components like packed cells, platelets, fresh frozen plasma, and cryoprecipitate. Imagine with one act of kindness, you could potentially save a child, a mother, a father, or a friend. So you can provide a glimmer of hope to a family in despair, a light in their darkest hour. Now, why do we need to donate blood? We all know that blood is the only fluid which cannot be substituted for any other form. So we need to get it in the same form through the process of donation. However, many of us are hesitant about donating blood for various reasons. Some are afraid of the needles, others are unsure about the process, but let me assure you that blood donation is a simple, safe procedure which is carried out by trained professionals. The needle pricks may be minor discomforts as compared to the immense satisfaction of knowing that your blood could potentially be life-saving. We often hesitate when it comes to donating our blood because there are many myths surrounding blood donation, that it may be painful or it is bad for our health or that it is time consuming. However, these are just misconceptions. Blood donation is safe, it is quick, and it is a painless procedure which can save a lot of lives. The human body is incredibly resilient and starts replenishing the blood that is lost in donation almost immediately. Now, who can donate blood? Any healthy individual between the ages 18 and 60 years who have a minimum weight of 45 kgs. Men can donate with an interval of 3 months and women can donate at an interval of 4 months. In everyday life, we come across individuals who are in urgent need of blood. It could be because of an accident, a surgical procedure, a chronic illness, or conditions like anemia. Most often, it could be illnesses such as leukemia, or it could be childbirth, which requires blood in various forms in case of an emergency. Furthermore, blood donation can also be beneficial to the donors themselves. It reduces the risk of heart diseases, enhances the production of new blood cells, and contributes to maintaining overall health. Also, it serves as a free health checkup as few of the basic investigations will be done at the time of donation. I believe it's mostly due to lack of awareness and understanding that people hesitate to donate blood. That is why we need to spread the word about the importance of blood donation. Encourage our friends, our family, and our community to participate. Together, we can remove the stigma around blood donation and create a culture of voluntary blood donation. Now, there are a few things that we need to remember before donation. Get plenty of sleep the night before you plan to donate. Eat a healthy meal before your donation. Avoid fatty food. Drink plenty of water before donation. And also check with the healthcare provider to see if any medications that you have been taking or recently have taken would prevent you from donating. At the time of donation, what do you expect? Before you can donate, you will be asked to fill out a confidential medical history. So this includes questions about behaviors known to carry higher risk of blood-borne infections, that is, infections which are transmitted through blood. Because of the risk of blood-borne infections, not everyone may be able to donate blood. Also, you will have a brief physical examination. So this exam includes checking your blood pressure, pulse, temperature and hemoglobin level, and also in some cases blood group may be done then and there. So if your hemoglobin concentration is within a healthy range and you have met all the screening requirements, you can donate blood. So after the procedure, you can sit in an observation area where you need to rest and eat a light snack. After 15 minutes, you may be able to leave. So after donation, you will have to drink extra fluids, avoid strenuous physical activity or lifting heavy weights up to 5 hours. So sedentary workers can get back to routine work. And if you feel lightheaded, you can lie down with your feet up until the feeling passes. And keep the bandage on and dry for the next 5 hours. If you have bleeding, after removing the bandage, just apply pressure on the site and raise your arm until the bleeding stops. So if bruising occurs, apply a cold pack to the area periodically, that is during the first 24 hours. Consider adding iron-rich food to your diet to replace the iron that is lost with blood donation. Also, contact the blood donor center or your healthcare provider if you have forgotten to report any of the health concerns, and if you have signs and symptoms of an illness such as fever within several days after your donation. So in conclusion, blood donation is a selfless act that can save lives and improve the health of both recipients and donors. By understanding the need for blood donation, recognizing the benefits and taking action to donate, you can make significant difference in the lives of those in need. Let us take the first step today and become a blood donor. Together, we can ensure that the gift of life is always available for those who need it the most. Thank you.